Hello, my name is Ashley. I am going to be using this hot dog to be a IV insertion. So we have to first verify that we have orders for IV insertion and whatever IV medication or fluids we are giving. Gather the necessary supplies such as the tourniquet, the needle, an alcohol swab so that you can clean it, and the tachyderm for emplacement. And then you also want to have the syringe for flushing it, which we do not have supplies for. You want to then introduce yourself to the client, verify the client with name and date of birth, or whatever you have available. Sometimes it is a picture. Verify if the client has any allergies, especially towards latex or shellfish, depending on what you're giving. Provide privacy for the clients. Provide client education, such as why you're inserting the IV, most likely because of dehydration. And then you want to perform hand hygiene and put on your gloves because you don't want to touch a person's blood with your bare hands. Assess the client for an appropriate site for the IV insertion. If they're going to be moving around, do not put it on the inside of the elbow, which is called the antecubital. Put it on the top of the forearm, just slightly above the wrist area. There is normally a very nice vein there to use. Once you select the appropriate site, place the client in a sitting position or low fowlers, and make sure to have a towel or protective pad underneath the arm to help elevate it. Select and palpate the vein so that you know which appropriate vein you're using. And then you want to use your alcohol pad and clean the site in circular motion. Do not touch it, and instruct the client to please do not touch the area. And then you will want to apply the tourniquet. Make sure it is not too tight, but tight enough to start putting in the circulation, to stop the circulation. Now you will go and insert the IV. Make sure the bevel is up, anchor down on the bottom part. Make sure it's at an appropriate angle, which is about 20-25 degrees. And then insert into the vein until you get a flashback. Once you get the flashback, go ahead and continue going until you reach the catheter hub. Once there, you want to make sure to push down on the vein, withdraw the needle without stabbing yourself, activate the safety device, and make sure you can flush it. That way it doesn't go everywhere. Once that is ensured, take off your tourniquet. It is no longer going to gush out blood. It is good. And then you want to apply the tachyderm on top. That way it stays in place and nobody touches it. Once you stabilize it, flush the IV, and observe for any signs of infiltration or leakage. And then make sure to, on the side, label the tachyderm with your name, your initials, date, and time of the insertion. And then anything further we go into would be initiating the IV infusion, such as verifying your 5 rights, the orders for it, preparing the tubing that you would need, and then that is a whole different area that we are not covering for today. So that is it for now. Thank you.